Research on the most common diseases in tropical Africa has shown that 80% of all these diseases are preventable. On the contrast, the government continues to allocate a huge percentage of its health budget on curative medicines and only allocates a mere 15% on preventive health care.
But if you take, for example, the diseases we face in this country, and you look at it from malaria, a very big portion of it, if we keep on investing in preventive area, you'll find that it will have a very big impact. It is caused, malaria, mosquitoes breed in stagnant waters. So if the drainage is taken care of, the impact is great. If you talk about people sleeping under mosquito nets, that's another very preventive kind of an approach.
Various experts in the sector now say that the problem might be that with investing in preventive healthcare, most diseases would be eliminated, hence less drugs would be needed. My research further shows that in countries that have so far benefited from cheaper drugs like Bangladesh and India, the solution was eliminating middlemen, who add the cost of these medicines by 33% on each middleman in the chain. Furthermore, 1 shilling invested in preventive healthcare is equal to 10 shillings that would be used to cure the same illness. Practitioners in this sector now suggest that with pooling together of resources as insurance companies do instead of paying each time you visit a doctor would actually bring down the cost of healthcare.
Financing of healthcare, if you look at the way we are running healthcare in Kenya today, it's a very expensive model because about almost 60% of it is coming from out of pocket. The people who go to see the doctors pay from their own pocket. It's a very expensive model. What you want to do is to build up a pool that you can be able to control or manage the cost rather than an individual being charged whenever he comes to see a provider.
The government must also chip in and give more incentives to the private sector. Imagine, over the last 20 years, Nairobi has only witnessed a single private hospital erected because the risk of investing in healthcare is too great.
Because if somebody, like it happens so often in our clinic in Isaiah, somebody is knocked down on the road and a good Samaritan or the police bring them to AR clinic, we have to treat them.
The private sector now suggests that the government should privatize defunct public hospital wings, and this would improve treatment in public health facilities. And with continued higher demand on healthcare globally, medical websites are attracting the largest number of hits, and local facilities are not being left behind.
We at AR recently opened up an e kind of commerce. People can pay for their own relatives here from abroad. The number of hits we are getting is very, very encouraging. And it is happening everywhere. And it tells you that the whole role of healthcare is a concern for everybody.
And a reminder to all our viewers from the doctors.
The responsibility of health is first and foremost yours, not mine, not the doctors. Maybe there is some truth in saying that the future doctor will not be a medical doctor but a nutritionist.
Even as experts continue to formulate a national healthcare financing strategy, it is important to remember that you can reduce the chances of getting diseases by washing your hands, brushing your teeth, simple things that you take for granted. Reporting for Channel 1 Busy, I am Kamau Mbote.